Are you a sinker or a sagger? The answer will predict how you're most likely going to age. As your beauty bitch, of course I'm going to break down both for you and let you know what it means in terms of how you should be prioritizing your anti-aging efforts. So I did a very in-depth video on this back in the day to really show that both sagging and volume loss are the top things that really make you look old, even over things like wrinkles and discoloration. A quick example I'm gonna give right now is Kathy Hilton. So Kathy Hilton has no wrinkles. We all know she's had a lot of work done, but she still looks older. She doesn't look young. How do you know that? Even though she has no wrinkles, it's really the changes in her facial shape, specifically sagging that you've seen has occurred as a natural part of aging. So in a world of sinkers and saggers, Kathy is an example of a sagger. Now let's look at Kelly Ripa as an example, who is an infamous sinker. So yes, this is not very recent. It was still a couple of years ago, but you can still see the point. You can see here that it's not like she's crazy wrinkly, but the reason why you know she's not 25 is because she's starting to really lose plumpness and fat around her face, in particular around the eye area as well as around the mouth and jaw area. It was really hard for me to find a celebrity with volume loss. It's not because it doesn't exist, but most of them have gotten filler to get rid of it. So there's not a ton of celebs walking around with volume loss right now. And here we also have Sarah Jessica Parker, who is also a sinker, and you can see in the before and after where she's really started to lose a lot of fat in her face. And the two areas of the face that tend to age the most are around the eye and lip areas. So you can see for someone who is a sinker and experiences volume loss, what happens is your eyes kind of look more hollow and sunken in because the fat is gone. And same thing with your mouth area. So those smile lines definitely get more pronounced because things are kind of sinking in and your bone structure and all of that kind of gets more defined as you age. And lastly, what's unique to sinkers is that because you're losing so much fat in your face, your bottom jawline area can appear very crinkly, especially when you smile. And this is kind of what you see with Sarah Jessica Parker. It creates kind of those additional lines in your mouth area that weren't there before, but that's because your skin has really thinned and you've lost a lot of fat. And so it kind of just makes it a little bit more prone to wrinkling and being a little crinkly. Here we have another sagger. We have Tiffany Thiessen, who I adore because I was such a Saved by the Bell fan. But anyway, as you can see, this is her when she was younger and her now that she's a little bit older. So saggers tend to get bags more than hollows around the eye area, and they tend to get nasolabial folds that kind of push down and fold over. And lastly, our saggers are a little bit different than our sinkers in the sense that they tend to lose definition and contour, especially in their jawline area, which can cause jowls, for example, and also kind of make your face look overall a little bit rounder. So how do you know if you are a sinker or a sagger? If you tend to have a more round face, if you have some chubby cheeks going on like me, or if you're always being told that you have a baby face, you are most likely a sagger. On the other hand, if you have a very defined cheekbone, you have a longer face, you have a skinnier face, you have a more oval face, you are probably going to be a sinker. Of course, differences in weight can really play a role, but other than that, it's really genetic. And within families, those genes can even really vary because the example that I had before, you have Gigi and Bella, for example. Gigi is definitely more of a sagger. She has kind of a more rounded face. I think this is when she has a little bit of masseter Botox, but if you look at her, when she was younger, before she had work done, you can definitely see that she kind of had that very round baby face. Bella, on the other hand, also has had a lot of work done. I think both women are beautiful and I love them, but you can tell like she has a very skinny facial contour now, and you can actually see like in that very chiseled cheekbone look where she's going to probably lose volume when she's older. So the question is, what do we do about it? Nothing if you don't want to. Aging is natural. But if you want to get ahead of it, there are a few things you can do both topically at home as well as in office. So topically, how you treat sagging and volume loss is pretty much the same. And the answer is what I preach in every video. I'm sure people who follow me are so tired of hearing it, but it is collagen. I've done so many videos on the best ways to build collagen, but just to summarize, vitamin C, retinol, and sunscreen. Now, when it comes to in-office procedures, that's where you're going to kind of see a difference in terms of how we treat sagging versus volume loss. So in terms of sagging, a lot of doctors are going to recommend things like oil therapy, lasers, things like that are really going to lift and tighten the skin. You can also do a little bit of Botox in certain places that will give you like a micro lift. If you're freezing certain areas of your face, it's gonna give you like a lifting effect. For volume loss, often doctors are going to recommend filler, which will really plump out any of those hollow areas. There's also fat grafting, which can take fat and put it in those areas where you've lost it. And in many cases, things like PRP, which can kind of regenerate and re-stimulate some of those fat pads around areas like your eye. And then lastly, there are collagen stimulating treatments that you can do in office, which your doctor might recommend whether you have sagging or you have volume loss. Those include microneedling, for example, which is little needles that kind of create micro wounds in your skin to naturally stimulate collagen, as well as Sculptra, which are injections that can actually help stimulate collagen. So yes, I'm definitely gonna be a sagger with my round baby cheeks. Nothing I can do about it. It is what it is. And again, no worries. It's kind of a natural part of aging. So nothing you can do to prevent it completely. And like I said, all these celebrities also experience them and still look fantastic and amazing. But if you want some tips about how to delay them, please let me know. Drop me a comment and let me know if you are a sinker or a sagger.